VX-Tezacaftor-Ivacaftor in patients with cystic fibrosis and one or two Phe508del alleles. Definition: VX-445 is a next-generation cystic fibrosis transmembrane conductance regulator corrector designed to restore Phe508del CFTR protein function in patients with cystic fibrosis when administered with Tezacaftor and Ivacaftor.
Episode of Demystifying Medicine. On today's episode, we will cover cystic fibrosis. We will be discussing the basic biological principles of cystic fibrosis, the organs affected, and the various treatment options for this disease. So what do you, a panda, or a neighbor's pet have in common? You're all made up of cells. The cells can be thought of as the subunit of life. Inside these cells are a set of instructions called DNA. DNA is made up of the bases adenine, guanine, cytosine, and thymine. You can think of these bases as instructions that code for genes in your body. For example, the DNA contains instructions for traits such as hair type, eye color, and height. When a nucleotide base is added, removed, or substituted, it is known as mutation. These mutations can change the DNA code, which may affect the traits that are expressed in your body. Now that we know the fundamental genetic makeup of our body, let's move to the next big question. What is cystic fibrosis? Cystic fibrosis is a disorder caused by mutation in the cystic fibrosis transmembrane conductance regulatory gene, known as CFTR for short. This mutation occurs on chromosome 7. This disease is an autosomal recessive disorder, which means that the disease is inherited when a child inherits a defective copy of the gene from both parents who are carriers of the gene. A carrier is an individual who has a defective copy and a normal copy of a gene.
Application in nursing. A study evaluated the effect of VX-445-Tezacaftor-Ivacaftor on Phe508del CFTR, protein processing, trafficking, and chloride transport in human bronchial epithelial cells.
A patient with cystic fibrosis is susceptible to infections of the lungs. This is due to a mutation that affects a protein on the surface of lung cells. Many different mutations can cause cystic fibrosis, but all of them involve a transmembrane protein called CFTR that functions as a channel for chloride to move in and out of cells. In this case, CFTR is less able to transfer chloride ions out of the cell compared to the functioning protein in people without cystic fibrosis. The channel is, in effect, locked shut. This inability to transfer chloride ions has an effect on the outside of the cell. In people without cystic fibrosis, there is a balance of chloride ions inside and outside lung cells, which maintains the right amount of water and salt ions in the mucus lining the airways. Cilia normally sweep the watery mucus from the lung lining, keeping the surface clean. In patients with cystic fibrosis, chloride ions concentrate inside cells and draw in water by osmosis.
Pros and cons. Pros. In vitro, VX-445-Tezacaftor-Ivacaftor significantly improve Phe508 CFTR protein processing, trafficking, and chloride transport. In patients with cystic fibrosis, VX-445-Tezacaftor-Ivacaftor had an acceptable safety. Cons. Adverse events leading to discontinuation of the treatment includes thrush, elevation, bilirubin level, and chest pain. The most common adverse events were increasing symptom producing infecting pulmonary exacerbation of cystic fibrosis, hemoptysis, and pyrexia.
CFTR protein stands for cystic fibrosis transmembrane conductance regulator. It's a pore on the cell surfaces of many organs in the body, including the lungs, sinuses, pancreas, and the gut. It's responsible for the movement of salt and water on these cell surfaces. The cell surfaces need the salt and water to keep regular health and is a problem when not functional in cystic fibrosis. When it's not functional, we have a loss of normal function, and that results in several downstream problems, including reduced clearance of mucus and a lot of inflammation, which cause damage to organs in the body. The abnormal protein function is due to mutations in the genetic code, or the information which encodes proteins, known as DNA. When the DNA is faulty, it results in abnormalities of the protein function at various different levels. There's a wide range of work being done in the cystic fibrosis community to address the problem of faulty CFTR protein function. This ranges all the way from clinicians to basic science researchers who are looking at ways to understand the protein malfunction and researching new drug therapies which target various mutations which cause different problems of protein function. As you can see, this is a very central problem and a very central focus for the cystic fibrosis community, and therefore the entire range of specialists in this field are being for a greater number of patients with different CFTR protein and gene mutations.
Is applied in Ecuador. The use of VX-445-Tezacaftor-Ivacaftor to target Phe508del CFTR protein resulted in increased CFTR function in vitro and translate to improvement in patients with cystic fibrosis with 1 or 2 Phe508del alleles.
Or CF, is a genetic disease that affects multiple organs, including your lungs, and limits your ability to breathe over time. Your main airway, called the trachea, branches into each of your lungs. The largest airway within each lung is called a bronchus, and each bronchus branches into smaller airways called bronchioles. Normally, airways are coated inside with a thin layer of fluid and mucus. The mucus catches dust and germs from the air you breathe in. Then, hair-like projections on the airway surface, called cilia, push the mucus, trap dust, and germs out of the lungs. In cystic fibrosis, the mucus is so thick and sticky that the cilia can't push it out of your lungs. This thick, sticky mucus can build up, trap germs like bacteria, and block your airways. Because of this, you may periodically have acute infections or exacerbations of the disease, causing symptoms such as increased coughing, production of mucus, and shortness of breath.
Conclusion. The use of VX-445-Tezacaftor-Ivacaftor to attack to Phe508 protein of CFTR resulted in an increase of CFTR function in vitro and resulted in improvement in patients with cystic fibrosis with 1 or 2 Phe508del alleles.
In lung airways and passages in other organs, cell surfaces have tiny proteins called CFTR. These act as channels for chloride ions to regulate the movement of salt and water in and out of cells. In cystic fibrosis, this process is disrupted because of a mutation or error in the CFTR gene, which provides the instructions for making CFTR protein channels. As a result, thick, sticky mucus builds up in many organs. Some CFTR mutations can cause what's called a gating defect, where the CFTR protein channels are present at the cell surface, but fail to open correctly. Kaleidoco is designed to keep CFTR protein channels at the cell surface open longer, to improve the transport of salt and water across the cell membrane.